Hello everyone, and welcome to this video on drug safety presented by the UIC chapter of the American Pharmacists Association Academy of Student Pharmacists, also known as APhA-ASP. Information for this presentation is provided by Generation RX and Operation Over-the-Counter Medicine Safety, two programs within APhA-ASP. My name is Eric Steele, and I will be your presenter for today. Today, we will be going over three topics. First, to give context, we will begin by discussing the scope, causes, and consequences of misusing prescription and non-prescription drugs. We then want to focus on how you as an individual can prevent the misuse of various drugs. To do this, we will briefly go over how to read medication labels so that you can obtain all of the important information regarding your medications. We will then identify 4 key messages for safe medication practices, which you can do yourself and teach to others, members of your family and community. Let's begin by establishing the beneficial impact of medications. Medications can help us lead longer and healthier lives when used correctly. Our life expectancy is the longest in history, and people are now able to live with many diseases that were once fatal. We are preventing or curing many illnesses and relieving troublesome symptoms, in part because of medications. But these powerful, sometimes life-saving, medications can also be harmful, especially when misused. Drug misuse includes taking more of a medication than prescribed or directed, taking a medication for a reason other than prescribed or directed, or sharing or taking someone else's medication. It does not matter if you have good intentions, misuse is misuse and can lead to serious consequences. Prescription drug misuse, in particular, has been called an epidemic by the Centers for Disease Control and Prevention, otherwise known as the CDC. Research indicates that millions of Americans misuse prescription drugs by taking them differently than the prescriber intended, and thousands do so for the first time every day. Prescription drugs are among the most misused substances in the United States, more than most illicit street drugs combined. Furthermore, there's no stereotypical type of person susceptible to prescription drug misuse. Prescription drug misuse occurs from the very young to the very old, in the rural and suburban communities, and among those of all socioeconomic status. It's not a youth issue. These risks apply to everyone, including adults. In 2016, 6.2 million Americans aged 12 and older reported misusing a prescription medication in the past month. So you may be asking, why is our community vulnerable to the misuse of drugs? We believe several factors fuel the misuse of these drugs. For one, we are a drug-taking society, and the use of medications has become normalized and even expected in our culture. There is this misconception that taking a drug is better than not taking a drug. We're also using medications at unprecedented rates, and even prescription drugs are relatively easy to obtain without a prescription. In fact, data from the National Survey on Drug Use and Health demonstrates that the majority of individuals that misuse a prescription drug get them from a family member or friend. In addition, there are also many misperceptions surrounding the safety of both non-prescription and prescription drugs, and the legality of prescription drugs. The list continues, but you can see how all of these things add up to increased drug misuse. We've identified various factors that fuel this problem, but how does misuse of drugs impact our community? Legally speaking, federal law prohibits the possession of a prescription drug without a written prescription. Many of the prescription drugs which are most misused are called controlled substances, for instance, Vicodin, OxyContin, and Valium, indicating there are even stricter prescribing and dispensing regulations for their use. Socially speaking, the misuse of medications can affect our families and friends, our job, our education, our finances, and much more. Reports published in 2011 indicated that in 2007, the annual cost of prescription opioid misuse to the U.S. economy was close to $53 billion a year. Finally, the most tragic consequence of drug misuse is that it affects our health, including drug overdose death, which is the leading cause of accidental death in the U.S. Death isn't the only health-related consequence, though, as both prescription and non-prescription medications can cause various side effects and even lead to chronic health issues if not taken properly. So now you may be asking, what can I do to prevent drug misuse? Well, one of the best ways to make a difference is to become more educated about the drugs you use and how to safely use them. Let's begin by going over the difference between prescription medications and over-the-counter medications. Prescription medications are prescribed by a doctor for a single person. They can be bought at a pharmacy and dispensed by a pharmacist, and are used by that single person. On the other hand, over-the-counter medications can be bought without a doctor's prescription. They can be found at various stores, including grocery stores, and they can be used by more than one person in a family for the same symptom or problem. Both types of medications also have some similarities. For instance, the medicine label, which includes directions, should be read and followed carefully before using any type of medication. A healthcare professional or the poison center can answer questions about the medication. And finally, it's dangerous to misuse or abuse any type of medication, as we've previously discussed. While a lot of Americans, statistics indicate about 95%, read some portion of drug facts labels, only half, 51%, say that they seek out packaging label for usage information when they plan to take an over-the-counter medication for the first time. So we'll be going over the various parts of a label so that you understand the importance of each part. First, the active ingredients are the parts of the drug that cause the desired effect. This section gives the amount of ingredient used, as well as the purpose of that ingredient. Next, we have the uses section, which describes what the drug is used for. If you are unsure if you should be using the drug, this is the part to check. Then we have the warning section, where you can find potential side effects of the drug and cases where you should avoid taking the drug altogether. The next section is arguably the most important. The directions tells you how to take the medication as well as what the maximum amount of medication is. Be sure to check this section when taking a medication for the first time. Then we have the other information section, which usually holds storage information. Improperly stored medication can become less effective, so take care in your storage. Next is the inactive ingredients, which is everything else the drug is made of. Be sure to check here if you or a family member has any allergies. Finally, some medications have a question or comment section so that you can contact the manufacturer about the particular drug. Here we have a prescription label, which shares many similarities with the over-the-counter label. However, much of the specifics about the makeup of the drug are replaced with more personal information, such as the prescriber's information and the patient information. Instead of directions, they also have the dosage of medication and sometimes the dosing schedule. Ultimately, much of the important information remains, but may be in a different form. Remember to check the name and drug on the label before using your medication. So now that we've talked about reading medication labels, let's talk about safe medication practices that you can follow to help prevent drug misuse. First, only use prescription medications as directed by a health professional. We can see the directions on a prescription bottle right here. Nice. With over-the-counter medications, the directions may be in different places depending on the bottle. Be sure to look for them. We see the directions right here. Good to go. Second, never share your prescription medications with others or use someone else's prescription medications. You are likely to do more harm than good. Good job. Third, keep your medications secure through safe storage by putting them in hard-to-reach places. This prevents young children from getting into them. Seems like a good place. If you can secure the medication with a lock, all the better. We'll give them an A for effort. If you need to get rid of a medication, you have 3 options. The first is to place the medication in a drug drop box. These can often be found in your local pharmacy. To find a drop box in your area, visit rxdrugdropbox.org. Second, you can take advantage of community drug take-back programs that allow the public to bring unused drugs to a central location for proper disposal. Call your local law enforcement agency or ask your pharmacist to see if there is a take-back program available in your community. If there is not a drug drop box or take-back program near you, there is a third option that allows for safe disposal at home. First, take a plastic bag and place your drugs inside. Then, grab an undesirable substance, such as coffee grounds or kitty litter, and place it in the bag. We went with both. Then, shake thoroughly to make the medicine as undesirable as possible. I'd say that looks pretty good to me. Finally, just throw the bag in the trash. Easy. And make sure to remove the label from a prescription bottle before throwing it away. And finally, model safe medication practices for those around you. Be your own health advocate. Learn what your medications are and what they do. Keep a complete medication record. And use your pharmacist as a trusted resource when you're not sure about things. When appropriate, discuss the dangers of misusing drugs with your family, friends, and colleagues. Before we end for the day, I wanted to go over what to do if you suspect someone has overdosed on a medication. First, call 911. Second, move the individual to the recovery position. This means placing the individual on their left side, with their arms under their head, and bending their right leg to prevent them from rolling onto their stomach. This position is designed to prevent suffocation if the individual vomits. Third, if you suspect an opioid overdose, and you have some available, administer naloxone. And fourth, stay with the person until help arrives. This brings us to the end of our program for today. If you would like help in teaching your community about prescription drug misuse, there are free educational resources at generationrx.org. If you have questions about the dangers of certain medications, ask your doctor or pharmacist, or call the poison helpline provided on the screen. I hope you have enjoyed this video, and I wish you a wonderful rest of your day.